Hi, my name is David. I'm a certified orthotist prosthetist, and hopefully I can help you pass your board exams. Now, we're going to go ahead and get started on the written simulation prosthetics section of your board exam. Hopefully I can make it so that you can pass your board exam so that you don't have to take the test again. And this happens quite frequently. At the beginning, I'm going to be talking about how to get to where you can get the information for the written board exam. Of course, I've already have this outlined in the first video, but I'm just going to go ahead and put this in the beginning of this one as well. And then we're going to go ahead and go into the systems. So the system is going to be how we are going to answer the questions. You're going to start with the socket. You're going to work your way down from the socket. And all you're going to need is the information that you got from Dominion 1, and you'll be able to pass this exam. If you use this tactic, literally, I was an hour early finishing my exam, and I was taking my time, and I was doing it this method, and guess what? I passed my board exams. So if you do this, I'm sure you'll be able to pass. It's a very simple way of doing it. Okay, let's begin. So we're going to go ahead and go in Google. You're going to go to Google and type in American Board of Orthotics and Prosthetics. Then you're going to click this little guy right over here. It's going to say American Board of Orthotics and Prosthetics. And then you're going to scroll down. It's going to say Become Certified. Click that. Then you're going to scroll down. Orthotics and Prosthetics. Click that. Then you're going to scroll down. There's a lot of scrolling down. Right here, Practitioner Exam Prep. Click that. Then you're going to scroll down all the way till you get to the Prosthetic Sim Test Content Outline. Then you're going to see Dominion 1 and you're going to see Dominion 2. Dominion 2 is formulation and the treatment plan. So on this part, it talks about evaluating, formulating, consult, identify, design materials, components, develop treatment plan, communicate to the patient and or caregiver, document treatment plan, ensure patient's responsibility, and inform their financial responsibility. So it's the same stuff that you would normally do in your clinic. So let's go through how we're going to be able to answer these questions quickly here. So this is the textbook. Obviously, you know what the textbook looks like. And there you go. So let's start with Dominion 2. Right above me is actually information for later. So don't get distracted. I'm going to go ahead and get rid of that. Just cover that up so you don't get distracted. So information. We have a female, right knee disarticulation, K3, uneven terrain, working cadence. So she has she can change her cadence. She works in construction. Remember we said that. Healthy limb, knee disarticulation. So first things first, we have to understand what we're working with here. K3, knee disarticulation. So knee disarticulation automatically puts her in a category where now the limb is a little bit longer. We can have a little bit more leverage. There's a little bit more information that we can kind of gather from here. Is she going to be weight bearing? You know, you can kind of go through your mind of how you're going to be able to go through this. Now in the textbook, it says generally people who are knee dis or tics are able to weight bear. Also, we understand that knee disarticulation, it takes 4 to 6 weeks after amputation before they're able to weight bear on their bone, which is stated in the textbook. Okay, remember, we want to always reference the textbook. Reference the textbook. You don't need to know exactly where it is, but you just have to know the information in your mind. What else do we know? Well, we know when they weight bear, that means that they can offset the load down to the distal end of their tibia, their femur, and now they don't have to issue a load, right? We understand that as well. We also understand that since there's a longer lever arm, they'll be able to use less energy because the limb is longer. And if you also understand that we have some examples here from the textbook, because I want to make sure that we understand what the knee dis or tic actually offers us just before we go ahead and get into it. So if you look on this, which is in the textbook, page 531. So page 531 in the Atlas 3rd edition, we have the force right here. Force is now just distal of the limb. And then if we were to have ischial containment, ischial seat, it would actually be transfemoral, which would be over here, TF, and the force would be distributed here on the ischium instead of right there distally to the limb. So we have a lot of advantages of it. That means that we don't technically have to have an ischial seat. That means that we can have a total, it has to be total, right? Like a total contact, right? Because that just makes a lot more sense. We also understand that the limb that we're working with right now is long. So that means that we have only a certain amount of types of limb length to work with. Also, the joints are going to be in a different position. So there's the knee joints. And then here we go. So this is another thing to understand. So since it's a knee disarticulation, we're still going to have adductor magnus, adductor longus, and adductor brevis, meaning we have all the muscles in order for them to pull in medially. And then we only have one muscle, technically, the tensor fasciae lata too, on the outside. But that's generally to stand, as you already know. And then we have posteriorly, we have the glute med, which then will help with that abduction. Abduction is just as important as adduction, you know that. But because we have a lot of the muscle groups, they're going to be pretty decently strong, which is good. So we have a lot of information just at the get-go, just from understanding the information that she is a knee disarticulation. And being a knee disarticulation, we can also use the condyles. We can use the condyles, which are right here and right here. We can use the condyles actually for suspension. So that's great. You know what I mean? So if we can use the condyles as suspension, as our example, here's an example. We can actually probably even put something here, maybe be able to suspend off the top here. Total surface bearing. So we have a lot of information here. We can even do a P-light inner aligner, have that fit, and then have them put that inside a socket, and that could be a possibility too, because they can probably push through that. So there's a lot of information just by knowing one thing, literally a sentence, knowing that she's a knee disarticulation on the right side. Now there are a lot of different components and things of that, but I just wanted to go and do this broad, quick overview of how much information we can gather just from knee disarticulation. That's a lot of information that we gathered from knee disarticulation. And another thing that we can gather from, just because it's a person in the society that we work and live in now, we already know that there's only two types of prosthetic componentry, right? There's two technical, there's the endoskeleton and exoskeleton. If you look on the bottom here, you can actually see endoskeleton and exoskeleton design, but you already know that there's two. Endoskeleton is where you can use the Allen keys to adjust it. Exoskeleton is where you can use, well, you can't really use anything. You got to cut it off and redo it. So it's actually a lot more difficult to work with an exoskeleton design, especially exoskeleton design is such an old phase. A matter of fact, I doubt that CFABs do exoskeletons as often or at all. Some people don't even do it at all. Matter of fact, if you're to do a lot of metal bending and prosthetics, if you're doing like an upper cuff or whatnot, you've already known the difficulty of getting that knee center pretty right on, unless you do it yourself. If you do it yourself, yeah, okay, you can do it. But general CFABs have a lot of difficulty having to deal with that. Okay, and so we got the right knee disarticulation. We have K3, uneven terrain. So we already know that she's going to be above average, so we don't have to worry about a lot of these types of feet. So K3. Now, when I'm looking at this, I'm already in my mind saying that K3, K3, K3. I have an uneven terrain. I already have in my mind this little guy. So right here, I have this in my mind. It's just a little chart. It says K1, K2, K3. There you go. And K0, 1, 2, 3. So I have already in my mind information in my mind that I already know what K1 is for me, K0 is, K2, K3, and K4. In my mind, I already have prosthetics finished. So K0, there's nothing. K1, I'm going to have a manual locking knee, a satch foot. And then for K2, I'm going to have a stance control or polycentric. And then I'd have a flexible foot, a single axis polycentric knee, And then also flex foot single axis with polycentric knee. This second section is mainly for people with like hip disarticulations. Single axis and polycentric knee are really good with just stabilizing, for a lot of stabilization. Hip disartics really great. If stability issues, that's actually really great too for just normal trans femme as well. And then K3 we're going to do, there's a lot for K3 right here. K3, you get fluid control, hydraulic, knee, microprocessor, and dynamic response. So this entire chart is already should be already in your mind. You should already have componentry that's attached to a K level already. And of course, you're not just thinking X3 microprocessor for everything. You can do the arguments for all of those, the mechanical knees and whatnot, microprocessor knees, but I just take a second and don't do that, because this is just textbook, okay? Just textbook. It doesn't have to be field ready. It's just textbook with theories. And here you go. So all this information that I just went over you should already know. And it's a healthy limb. Healthy limb means that they're not having a lot of phantom pain, not a lot of discomfort or anything. So knowing all that information, it should be able to get you to the next level. So we're going to be choosing the prosthetic type, okay? Choosing the prosthetic type. So when you get the exam, you will pull out a piece of paper, okay? You're going to have the piece of paper. Every time you click something on that exam, it's permanent. So don't click on anything on that exam. You're just going to open it. And you know what else you're going to do? You're going to scroll, okay? Scroll. Make sure that you have everything that you can see on there, you know? And that way you have all the information. Because sometimes if you don't scroll, there could be an item that is better than what you were going to choose. And then for example, so if it was like this and I didn't scroll, and then I clicked all my stuff and I said continue, and I scrolled a little bit down and look, it says total contact. All of a sudden I lost a point for no reason other than I didn't read everything. Second thing, after you take the piece of paper, you're going to write down one all the way, all the options that you could possibly choose. You write that on your piece of paper. We'll do all the way to 20. Once you write all those numbers down, all you're going to do is going to do X's or checks, okay? And that's going to be how you can determine whether or not you're going to use that information or not. Are you going to check out the information? Are you actually going to do that information? And this is how I would do it if I were you in your shoes. I would actually have like all the numbers already finished, and then I would go ahead and go through this. So choosing prosthetic type. What did we say in the beginning? Do we do exoskeletal or endoskeletal? We do endoskeletal. Now, with this type, we're just going to do endoskeletal. And are we going to click this one? Because we're starting at the top, right? We're just going to start with the general prosthesis. Endoskeletal? Okay, so we're going to do left or right. Let's see. It says right. So right away, left is wrong. We're going to put an X there. Just on a piece of paper. Put an X by 1. Then we're going to go down. Be like, okay, endoskeletal. Hey, if you want to pause right now with all the information that's right here, go ahead and pause. And then you try to do this by yourself. So you're going to get all this information here and all the information here. So with just the information from Dominion 2, okay, and there, and then now all the information from here, just pause. You can write this down, whatever it is. And then you can come back later and let me know, or grade yourself afterwards and comparing my notes to what I've decided. Mind you, I actually checked the textbook for these. If you have any other opinions on it, you can go ahead and let me know. But I'm mainly pulling out of the textbook. So we're going to do an endoskeleton design. It's not left, it's right. This is exoskeleton, so that's wrong. This is endoskeleton right design. So this is what I want. Okay? And am I certain by this information? Yes, I am certain. So I'm going to underline it. As a matter of fact, I'm going to bold this because this is the one I'm going to choose, but I haven't yet written it down on the test itself. I haven't clicked it. I literally have just put this on my piece of paper and put a check mark by it. This is what I'm going to choose. So, or I just, underlined or whatnot. So flex foot. Okay, so that's the bottom. We're not even going to deal with it. Gel liner. Don't even deal with it yet. Flexible keel. We're not going to deal with it. Window open lateral. Not going to deal with it. Ischial containment. Not going to deal with it. P-light. Not going to deal with it. Flex foot. Not going to deal with it. Polycentric knee. We're not going to deal with it. Single axis knee. Dynamic response. Multi-axial. Window medial opening. Durable lightweight material. Distal end pad. Pin. Socks. And total contact. Out of all of this information, the next step is, in my opinion, socks. Socks is that's going to be interfacing between the patient, directly between the patient and the device. Now, if you wanted to do gel liner, you can. You could most definitely choose gel liner. But also remember that, well, you don't want to be adding too much material too. You don't have a lot of space on knee Desertic. So I'm going to go ahead and choose socks. Here, socks is what I'm choosing. I'm going to bold, underline, and double arrow. Okay, that's what I'm choosing. I'm choosing socks. And another thing that I would want is, I'm actually thinking of something like a stovepipe design, right? Or I'm thinking of, it's either stovepipe or like any other design, maybe a bivalve, something that opens up. So here's some of the designs that you could choose. You can choose this one, which is, P-light. You kind of have a distal end cup, like a distal end pad, which you can see right here. There's a distal end pad. And throughout the reading, they talk about having a distal end pad. If you read this is 528 on your textbooks. But you can see how there's like a liner that is a bivalve, and you can put that on and slide into the prosthesis. Or you can have this with a window and a strap right here. Now, both designs, in my opinion, are fine. For me, I want to do a P-light liner. That's just something I like to do, P-light liner. And I'm probably going to do a window too. And if you look on this, they do offer P-light. So I'm going to go ahead and pick P-light, because that's going to be my choice, P-light. I'm going to do bold and underline, so I want P-light. And I want total contact. That's total contact, which is right here. And I'm going to go ahead and pick total contact as well, because that just makes sense, right? Because we're going from socks to P-light, but the whole device is contacting the patient. So total contact, super important. And the distal end pad. We just talked about distal end pads, and that's important if they're weight bearing distally. Okay, and let's go through this again, and we're going to cut out some stuff so we're not distracted. I don't like to be distracted a lot because I'm easily distracted. So flex foot left. Left, we already know left is not going to be one of them because that doesn't make any sense. Gel liner, we've already X'd out gel liner because we're doing P-light. Window open laterally, we're going to have to come back to that. Ischial containment, we're already distally end pairing by the distal end pad, so we're not going to do ischial containment. Plus, there is nothing that was said about the femur or the femoral head or the femoral neck being weak, so I'm not going to even worry about that. I'm just going to not do that. And then we're going to do right flex foot. Right flex foot, we're going to think about that one because it's right instead of left, which is great. Polycentric knee, that's pretty okay. But we're not in the knees yet. We're not doing knees yet. We're not doing feet yet. We're not doing ankles yet. We're still thinking socket, right? We're working our way down. So window open medially, a durable, lightweight material. Oh, we want this to be made out of carbon fiber, right? So durable, lightweight material makes sense. And then pin. Okay, we're not doing a pin because the length is going to be off and we don't have a gel liner, so it's not going to really attach to anything. So durable, lightweight material, let's go ahead and get that one because we want carbon fiber, right? And that's, see, and now you can see how we've already canceled out a ton of stuff here. So now we have the socket done. We have the suspension system, which is just going to be over the condyles. And now we can work from the suspension system, hard socket. Let's move down to the knee. All right, so what does the knee give us? So knee. So it's keel. No, it's a foot. Laterally open window. So let's think about that one. I'll put a V. Let's just check this one. The window. Let's underline it. And then, is there any other window that I see? So the window is next. Actually, I was moving on too fast. So we're going to do P-light, and we're going to try to suspend on the condyle. So I do want to put a window in there. So there's medially, and then there's a lateral window. Huh. How do you choose between a medial or a lateral window? That's a good question. How do you choose? Well, you open up your textbook here, and suspensions, removable window which can be fastened in place and allows the wearer to pass through the femoral condyles through the socket, preferably traditionally opening up located medially, where it is less visible. When the plate is responded fast and tightened, the prosthesis is suspended over the condyles. So here it talks about medial. Most likely we're going to go medial. And another really good thing about going medial, it's going to be a little bit more form-fitting. And then we can go back to looking at the muscles really quick here. So medial will actually be tightening around the adductor magnus right there. Is that a big problem? No, it's more of the attachment point of the adductor magnus. And is it going to be an issue? You know, sometimes it can be, sometimes it isn't. Of course, it's up to the patient. But if we just go ahead and go towards textbook tells us medial. So let's just do medial because that's what the textbook says. And it makes sense. So medial right window instead of lateral. See, and that's why you go through it. Literally read it over and over and over again. See, we're shrinking our possibilities here. So let's underline that. We're going to put an X here. And then we're going to go ahead and do the right medial window. We're going to bold that. And I'm going to go ahead and put an arrow towards that. So now we did the whole socket. The socket is completely done. The interface, all that upper level. Now we're just going to move to the knee. Is there knees here? So we got a polycentric knee, a single axis knee. Do you have any other things here? We got a flexible right keel. That's a foot. The flexible foot and right polycentric knee and single axis knee. And dynamic response foot. That's not what we're talking about. Multi-axial ankle. Okay, so let's talk knees here. Polycentric knee. Is that a good choice? Yeah, it's a good choice. Actually, I would consider that would be a pretty good choice. And then I got a single axis knee. Oh, that's a pretty good choice too. Let's look at componentry really quick. So when it comes down to componentry, do you see how I go back to the textbook like a good person? 529 edition, the 3rd edition. And you can go down here. It talks about componentry right here. It says components for knee disarticulation in particular. So what do we have here? We have one, which is the opposite joint, like the opposite outside joint. And then we have the knee mechanism, so traditionally used for transfemoral amputees. And then we have the knee disarticulation polycentric knee. And if they wanted, they could probably do a mix or a hybrid of some kind as well. But as you can see from the textbook, The textbook says these 3 options. All right. Does it say single axis knee? The outside knee joints would be considered a single axis knee. But why would you use an outside knee joint? Well, if you don't have a lot of space. Well, we're going to assume that we have a little bit of space there just to put up. Is it going to be a knee mechanism usually used for transfemoral amputees? Is that even an option? No, it's not. Polycentric knee is an option, and single axis knee is an option. Now, this person is very active. Okay, he's very active, likes to do cadences like fast, slow. So giving an outside knee joint to somebody would probably not be really beneficial for somebody that's trying to change cadence, because if she wants to go faster or slower, there's nothing that's going to stop or resist that knee motion. Plus, there's no mechanical stabilization, right? Because polycentric knees, as you should know, shorten during swing phase, especially like mid-swing, and then it lengthens. It doesn't lengthen, but it has a mechanism that allows it to lock, just mechanically lock during stance. And you can create a friction in order for them to be able to go quicker and slower with friction. So to me, my option is polycentric knee. It's actually the 3rd option here, which means it's probably the best option because we're going to do the most advanced option for K3, and we're going to choose that one. Polycentric knee. Now, what's the bad side of polycentric knee? Okay, maybe they can't sit down, right? Because if you do polycentric knee, it's not going to be able to lower you down into the seat, but she's strong enough. So I'm going to do polycentric knee, and plus she has another leg. So if you're bilateral using polycentric knees, maybe walking is fine for you, but having to sit down might be difficult for you because you can only unlock one knee at a time, and you'd have to slowly move down. So there's that. And so we got the polycentric knee that we just chose. Ba-doom. Polycentric knee. Put arrow here. And then the last little bit would be, okay, flexible keel and right flex foot. Single axis knee. No. Dynamic response foot, multi-axial ankle. So we're going to go with the ankle. Multi-axial, uneven terrain. She said that. So that's where she works. She works construction. She's going up and down hills. She wants to exercise. She's an active person. Her goals meet what we just said. So multi-axial will be able to adapt to the for the surfaces. Flexible keel. Is that what we want? No, that's K2. Flexible keel is K2. Say it with me. Flexible keel, K2. Satch foot, K1. I don't care. I don't care what you're saying. Textbook answer. Flexible keel, K2. Got it? Okay. Then, so we're going to go ahead and do the X for the K. And then we're going to do flex foot for the right. Flex foot? No. We're going to do dynamic response foot. And so we're going to bold, underline, and arrow. Bam, 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 bam. Ta-da! And now you've completed it. But after you complete it, what are you going to do? You're going to make sure you write it down. So how are you going to write it down? You're just going to write down. So 3. I want 3. Endoskeleton. Then I want 9. Then I want 11. Then I want 13. Then I want 14. Then I want 15. Then I want 16. Then I want 17. Then I want 19. Then I want 20. Do you see how this works? So once you have all of these written down, the 9 needs to be separated. So once I have all these written down, then I go to my paper. I go from my paper, and I go and double check. Is 3 right? Yes, that's what I want. Is 9, 11, 13, 14, 15, 16, 17. And you know what it's going to say? Probably it's just not going to say anything because you're just clicking componentry. So make sure that the 3 and the 9, 11, 13, 14, 15, 16, 17, 19, and 20 are all checked off on the computer. And then once everything's all clicked off, you're done. Dominion 2 completed. I went into as much detail as I could, just because I know these tests are hard and I know people are not out there, but just wait. I will be working on Dominion 3. So this actually takes me a long time in order to develop or create. So I would really appreciate it if you liked and shared it and then commented. Tell me about it. Tell me what I did that you would have done differently. Let's talk prosthetics. Let's talk orthotics. Let's have conversations down in the comments. Let's talk about it, because how are we going to get better as an industry if there's not a lot of education out there? And we need to work together in order to create an environment where learning and education are our main priorities. I am not here to hide anything from you. If there's a prosthetic thing or a way I can help you, I will tell you as soon as I find out. I am not going to hide anything. You can literally just ask me anything and I will tell you whatever I know, because I know by making it that you become a good practitioner, I become a good practitioner, because by me doing that, I am now increasing the knowledge in the world, which then in turn helps everybody in the world. Let's help the world become a better place by creating chances that we can educate more people. Okay, that's just my 2 cents. Let's be good, be healthy, and help a lot of people. I'll be working on Dominion 3, and take it easy. Oh, and pass your exams. Pass your exams. All right.